I wonder if you would explore a little further the role that alcohol plays, and particularly fatty liver.
hmm Yeah, so, alcohol is really not a great substance for our bodies. It's a huge part of social life. And I think that at this stage of life, it's a good time to really think about how does this serve me? Become a little introspective. Alcohol increases our risk for high cholesterol, deposition of fat within the liver. When we have increase in visceral fat and maybe our health habits have not been quite where they need to be, if we're eating a lot of ultra processed food, maybe not getting enough, of all the stuff we just talked about, maybe there's calorie excess. That combination wreaks havoc on the liver, and fatty liver is silent. You may or may not have abnormal liver tests when you go to your doctor, but if you're having a lot of the metabolic syndrome things start to creep up, you're noticing waist circumference going up, it's a risk factor for fatty liver. And reducing alcohol, in addition to all the other reasons why that I mentioned, can be a healthy thing to do for your fatty liver and for your health. And fatty liver is reversible. But when
Okay.
you have fatty liver over time, there's some small component of people that are actually going to develop fibrosis of the liver, meaning fatty liver or non-alcoholic fatty liver disease is becoming the number one reason for needing a liver transplant. So this is important. This is something that we want to think about, even though it's silent. And again, not to sound alarmist, really all the things we're talking about today are all interlinked. So if you're doing it for one reason, you're getting extra benefits in the other
Sure.
department. So, having this conversation with ourselves about how does alcohol serve me, finding other ways to relieve stress and to enjoy ourselves socially is very well worth mentioning.